I realized the Mexican-American people needed a lot of leadership and a lot of leaders. I didn't see myself as a savior of the Mexican-American people. I merely saw myself as a spokesman for them.
Dr. Hector emerged, right after World War II, and it was really an important time for Mexican Americans in Texas.
We needed a champion, and he was the right person at the right time for the Mexican American people.
In every period of history, always somebody appears that is needed to guide people in need or someone who is lost at that time.
You know, I think Dr. Hector came along about the right time when there was a lot of discrimination against the Hispanic population, Chicano, Latino, Mexican American, whatever you want to call them, that were mistreated, that weren't given the opportunities that other people were given.
Our country's history shows us what a precious few can do for the overall good. Dr. Hector P. Garcia was one of those precious few.
Even the hospital had segregated wards for Mexican-American patients. And sometimes I got sad in the fact that I, as a doctor, could put a patient in the hospital because the so-called Mexican-American wards were filled up. And although the Anglo ward would have one patient or the most, they would not allow me to put a Mexican patient with the Anglos.
I want to make completely clear that I am very proud to be an American citizen. I love my country, I love all the people, and I hope the Lord give me some more years to serve. Now, you question the American GI Forum was begun in 1948.
He had come back from conflict overseas, and he knew that Hispanics here in South Texas and elsewhere were being discriminated against. They weren't being treated fairly, and there were all sorts of examples of that. And he knew that something had to be done, and beyond that, because a lot of people knew something had to be done, he actually stepped up and did something.
Basically, it was organized to help the veterans with two problems. One problem being the fact that they were not giving us veterans hospitalization. We got organized for that. Secondly, we got organized because the educational level of our people was so low, we were not productive. So we were already working on those two things, better education for the veterans and hospitalization for the veterans.
Many of them had gone off to war. This is probably the first time they'd ever left their hometown or their farms. And when they came back, they expected something different. Certainly more equality, more opportunity. And Dr. Hector's emergence about that same time was exactly what they needed. He gave them the voice to seek equality, seek opportunity, but most of all to seek respect as human beings, as Americans.
And he was really outraged by the discrimination that he faced, that he knew was out there for the Hispanic and veterans.
Or one of the things that I have such a strong memory of him is, of course, his love for the veterans organization that he started, the American GI Forum. And with what pride he wore his hat. And I think that today there is a new call for his veterans organization to resurge, to emerge strong again, so that veterans issues can be addressed in the way that he addressed them. He knew how to bring veterans issues to the forefront.
In 1945, 46, 47, all the veterans were returned back from World War II. And once they returned back to their humble homes, there were certain things that they were not able to acquire for whatever reason. And someone like Dr. Garcia was able to guide them as they came to see him in the medical professional office. Not only told them their pains on their backs or legs or whatever, they also told them their problems. And he began to see the problems that they were having, that they needed someone to guide them. And so he stepped forward to take that leadership.
And when I think of a word that about Dr. Hector P., it's just inspiring. He was just an inspiring man.
The doctor, in one word, will be difficult. I would say that he was an unafraid miracle worker.
That he was, humility had to be one of his greatest virtues.
I would describe him in one word as a man of service.
You know, I've been thinking about this question for a while, how to describe Dr. Hector in one word. So many come to mind. I've mentioned the word champion before, I've mentioned the word patriot. But really, I think the word that from the youngest child to the oldest crony of his would understand and it would really resonate is the word courage.
President Lyndon Johnson and other people, President Kennedy, knew of his work. And they knew that he cared for people. And not only that, they knew that he was fair. Not only did he work to help his people, but in the process, he was fair to everybody. He wouldn't overwhelm the opposition. He would try to work with them, and therefore they talked to him, and they would always seek his advice because they knew that he was going to be fair.
He was very partisan in his politics, but he was very bipartisan in his philosophies. You know, I mean, he truly got along so well with both sides of the aisle that, honestly, I don't know if I have that in me. You know, he created such a gusto in all of us, but he got along with everybody, and he wanted everyone to understand, you know, his point of view. So he wasn't confrontational in a way that created animosity. There's a lot to learn from how Dr. Hector learned to agree to disagree. And it was that statesman-like quality in him that made him an ambassador to the United Nations.
He saw at a very young age the injustices of the Mexican Americans, including access to health care. And he dedicated his life to ensure that they would have that access both in his generation and for generations to come.
The way he used to help people at his medical offices are legendary. He didn't care or certainly didn't demand payment. He was interested in helping people on many different levels, and so that's the way he conducted his life. Yes, I interviewed him, I met him socially several times. Always a pleasure.
I would go out and interview him out at his medical offices, and he was talking to me, and then he was talking to the nurses and secretary at the same time. He was carrying on this sort of bifurcated conversation. He didn't have time or the luxury to set aside time for a news interview. The news interview had to go on while he was doing all these other things. I remember one incident in particular, and I had known him now for many years. He calls, I'm at the office, it's late in the afternoon, and he tells me he wants to bring over a press release. So a little while later, here he comes, striding to the newsroom. We go back to my office. He's talking to me. I don't remember the details of the news release, but I do remember this. He's talking about the news release, and then he stops. He looks at me, and he says, wait a minute. He gets up, and he comes around to my side of the desk, and he says, tip back your head. And I did. And he starts looking at a mole on my face. I had a lifelong mole right about here. And he starts looking at the mole. He puts his finger in his looks and he says, you should take care of this. And he says, now don't tell the medical society I'm making house calls. Well, he says, go see Dr. Grossman, who was his good friend and classmate for the University of Texas Medical School. And sure enough, about 2 weeks later, I went to see Dr. Grossman, and I had it removed. And when I tell Dr. Grossman this story, he says, yes, he and Hector had been classmates at the university, and they knew each other all these years, but I'll never forget that incident. Yes, I was a newsman, but he was personally caring about my health. What a telling thing.
Many times when I would go to his office, there were several people, I mean dozens of people waiting. And I knew that most of these people didn't have insurance, they were poor, but they didn't leave the office because it was crowded, because they knew that the doctor was going to take care of them. And this is the type of gentleman he was. And I would sit around and joke with the people who were there, and some of them were mostly very elderly people. But he would come out and he would just look around and see all these people. He would just shake his head. But they knew that he was there and that he was going to take care of them.